Now, there's a criteria in which we use to diagnose Marfan syndrome, and this is what is known as a Ghent criteria. Okay, Ghent criteria. So for this Ghent criteria, we use it to diagnose Marfan syndrome, and here we're trying to, look at everything you're supposed to know on that Ghent criteria. So it's an internationally accepted guideline for diagnosing Marfan syndrome. So the revised edition is what we actually use now, which we'll be looking at, So background, it was first introduced in 1996, and the Ghent criteria was updated in 2010 to reduce misdiagnosis and also improve accuracy. The revision replaced greater weight on cardiovascular manifestations. It placed greater weight, Actually, okay. So it placed greater weight on cardiovascular manifestations, since the aortic root disease is the most life-threatening aspect of Marfan syndrome. Okay, that's what we got. So the key diagnostic pathways that's for the revised one. If the person doesn't have a family history, there's nobody in their family that they are able to trace that has Marfan syndrome, but the diagnosis will be made if you have aortic root dilations and ectopic lentis if they are present, or if you have aortic root dilations and there is a confirmation that there is a mutation in a gene known as the FBN1 gene. Then also, or if there's an aortic root dilation and a systemic score that is more than 7 based on the physical features. Do you understand? This is the revised one. Physical features is what is in this picture. The signs and symptoms: disproportionate long leg, disproportionate long arm, pectus carinatum or pectus excavatum, stretch marks, the arm length is greater than the body. Okay. Then also, if there's ectopic lentis and a confirmed mutation in the FBN1 gene, okay. So but if the person has a family history, if they find out that somebody from your family has an issue similar to this, it's much more easier to make diagnosis now. Once you have ectopic lentis, fine, they move. Once the systemic score is more than 7, they move. Once there's aortic dilations, they move. You understand? So what is the systemic score features? I know I was talking about systemic score and I was talking about systemic features, and you guys were not, understanding. Okay, so what are the features? If the person has wrist and thumb signs, that's basically their hands is kind of like too flexible. They're able to bend their hand, is 3 points. Pectus carinatum, 2 points. Foot deformities, 2 points. Pneumothorax, 2 points. Then reduce upper to lower segmental ratio, 1 point. The person has scoliosis, 1 point. Have facial features. Okay, just look at their face, crowded teeth, high arched nose, neck. You understand? Ocular hypertension, intraocular dislocation. Do you understand? That is all the things you look at. That's 1 point. Then if they have all those stretch marks is what we call the skin striae. It's also 1 point. Okay, so that's what we have for this Ghent criteria.